So some of the sessions at this year's Patient Safety Congress, we looked at things like forgiveness, people talking about restorative culture and talking about some of the closed cultures. We also addressed all the workforce challenges that the NHS is facing at the moment, something I think will help people go back to their organisation and make the change that we need them to.
It's about bringing together leadership, and it should be about leading all of the people all of the time and not some of the people some of the time. And what this platform does is enable us to do that.
We wanted to share the results that we had achieved doing our patient safety project to see whether it might inspire other people to do similar kinds of projects, but also for people who might be experiencing the same problem to say that actually there are some solutions here that you may want to adopt.
Today I came to acknowledge challenges within the NHS, to report on progress, good progress that people have made in the safety journey, but also talk about where we need to go next and give a little bit of my thoughts of what I've learned along the way.
People need to know what's happening because they don't get told, so they really need to know what's going on behind closed doors.
It's really important to be at the Congress because it gives us an opportunity to learn from our colleagues across the NHS and wider healthcare continuum, and to ensure that we're constantly engaging in conversations at the vanguard of patient safety initiatives and improvements.
We've got a couple of new systems that are coming into place at our trust, so we've been able to use them here and see sort of how they work, and then networking with other trusts as well.
I think the pandemic taught us that mental health, it's important to everyone. As we come out of the pandemic, the challenges people have been facing, we need to really address the issues from a societal point of view, but also as a country.
I'm an emergency department matron, but I'm also the nurse clinical governance lead, so a lot of my role revolves around patient safety, incidents, complaints, and when I saw the agenda, it was perfect.
One of the key sessions that stood out for me really, and the one that we've talked a lot about, is the restorative justice and the difference between responding to an incident in terms of the patient's perspective.
We were all looking at technology and patient safety from slightly different perspectives and uniting in the view that we all need to make sure that technology and patient safety delivers safer and more effective care.
I was talking about forgiveness and apology. The two concepts are deeply related, of course. Sincere apology done easy and quickly when there's been medical harm could save the NHS millions of pounds.
So there are a number of issues, all of which very much is around the culture of organisations and how we ensure we continue to get our staff to speak up and trust executive teams to make sure we do take improvement actions and make a difference for our staff as well as our patients.